Assalamu alaikum, Dr. Rashid Mahmood here. In this video, we'll discuss the very important topic from exam point of view. That is the viral serology of the hepatitis B. That how will you interpret it for solving the MCQs? So this picture is showing a structure of hepatitis B virus. That is a DNA virus having three important antigens. These are the surface antigen, the core antigen, and the envelope antigen. And in the center is the DNA virus. So these are very important antigen, and these will decide that whether patient is having some acute infection, chronic infection, or any stage of chronic infection. So these three antigens and hepatitis B virus DNA is very important. So in viral serology, the hepatitis B surface antigen indicates the presence of hepatitis B virus infection. It doesn't distinguish between the acute and chronic infection. So hepatitis B virus surface antigen cannot differentiate whether the infection is acute or chronic. And the important thing is that it is the earliest marker to be seen in case of hepatitis B virus. So it is also a MCQ. Next is the anti-hepatitis B surface antigen. So these are the antibodies that form against surface antigen, and these antibodies are the only antibody which provide protection against the hepatitis B virus. So they can be seen in case of natural infection or in case of previous patient is being vaccinated. Next is the anti-HBC total, that is the antibodies against the core antigen. The total antibodies tell us that the patient has been exposed to hepatitis B virus, but it cannot differentiate whether the patient is having acute infection or chronic infection. The antibodies against the core antigen, that are IgM antibodies, these are very important because these are the only serological marker that is positive during the window period, and it is also very important that it tells us that patient is having acute infection. If this antibody is positive, this means that patient is having acute infection. If this antibody is negative and it is in the form of IgG antibody, then this means that patient is having the chronic infection. So IgM hepatitis B core antibody is acute infection, and IgG is the chronic infection, or even again will be seen in case of patient is being immune as a result of natural infection, then also can be seen that. But if IgM is present, it shows that exposure and acute infection. The hepatitis B virus E antigen shows that the virus is replicating very fast, and it also shows that patient has high chances of infectivity. That if patient has been contacted by someone, then there are higher chances that the exposed person is having will get the hepatitis B virus. Anti-HB against HBE tell us that the patient is having low viral load, low viral replication, and less chances of infectivity. And then comes the HBV DNA, that is used to monitor the level of viral replication in the patient during treatment, and also 6 to 12 months in chronic infected patient. So we will discuss now the serological marker in different condition. Suppose all the things are negative. Hepatitis B surface antigen is negative, anti-HBC is negative, anti-HBS is negative. So this means that patient has never been exposed, patient has never been vaccinated, so that patient is susceptible patient. Now, if a natural infection occurs, then the patient will get two positive things. One is the anti-HBS surface antigen, and as patient is exposed to naturally virus, so patient has been exposed to the core antigen, so antibody against the core antigen will also be present. So two things will be present. Now, if patient is being vaccinated, then only one thing will be positive, that is hepatitis B surface antigen. As patient has not been exposed to virus, so the core antigen will not be, there will be no exposure of core antigen, so anti-core antibodies will also be not present. So only surface antigen antibodies will be present. In case of acutely infected, as I have already told us, that important thing differentiating is that the core antibody will be of IgM type. So acutely infected will have core antibody of IgM type. The rest of things we can be seen like surface antigen will be positive, and anti-HBS will be negative, and anti-HBC total will be positive. In chronically infected patients, the important thing again is that the antibody that is seen is the anti-HBC will be positive, and IgM will be negative, and IgG anti-HBC, that is core antigen, will be positive. So the core antibodies differentiate whether acutely infected or chronically infected. Now, if patient is chronically infected, then they can be further classified into the 4 stages depending upon the viral load, the E antigen positivity, and the ALT level. So suppose a patient who is being infected and having positive surface antigen and positive core antibodies against in the form of IgG. So that patient is chronically infected. So we will do all these three tests in that patient. If all of these three, E antigen is negative, DNA is present but low titer are seen, that are less than 2000, and ALT is normal, so that patient is labeled as an inactive carrier. Patient is carrying virus but that is not active. Next stage come that patient is having E antigen positive and HBDNA is also elevated, but the ALT is normal, so that patient is labeled as immune tolerant. It means that immune system is not activated and patient's hepatocytes have not been damaged and there is no damage ongoing occurring in that patient. In immune active phase, the DNA is elevated as well as E antigen is positive, and simultaneously the ALT is elevated. So it means that virus is affecting the hepatocyte and immune system is destroying the hepatocyte. That's why ALT is elevated. Next stage come, that is immune reactivation. It is actually a transition from the inactive carrier to immune reactivation. The person with inactive carrier, suppose a person who was previously in the stage of inactive carrier, now been given some immunosuppressive therapy or chemotherapy for the cancer, the patient has gone through some autoimmune disease, then the DNA will start suddenly replicating, so DNA will be elevated and in response ALT will be elevated because that this high viral load will start damage to the hepatocyte. As the patient has been transitioning, so the E antigen will be not present in this step. So this was a brief review of the hepatitis B serology and its explanation. I hope you have learned something from it. Thank you.